All right. Hello, everyone. So we are really glad that you are here to join us today for this virtual information session. I do have a couple of housekeeping items to address real quick before we begin. So we ask that you do keep your microphone muted while our presenters are speaking, but please feel free to use the chat for any questions or comments that you may have during the presentation. Also, you may have gotten a notification about recording. This presentation will be recorded and shared out later next week. So if you're coming in late or you are unable to attend, we will be sharing out a recording of the information session. So without further ado, let's begin with some introductions. I'll go first and then I'll hand the floor over to Carmen to speak a little bit more about the program, and then Brittany and Zori to introduce themselves. So my name is Erica Newhard, and I am the new Dementia Outreach Coordinator here at United Way. I'm relatively new to this role. I just started 3 weeks ago, but I am super excited to be here and be a part of this program. I'll let Carmen say a few words.
Well, thanks so much for that, Erica. I'm glad that everyone is here today. Project Lifesaver is a life-saving program for those who are prone to wandering, whether it's due to cognitive decline or due to a child having autism or any type of issue like that. And we're pleased that the Fleming Foundation has made this work possible by providing a grant to support the dementia outreach work here in the Lehigh Valley. We've been able to train, I think, at least 9 police departments in Northampton County in the past couple of months. And now we're working to make sure that community knows that these bracelets for their loved ones are available and that they are free of charge. They just need to register to pick one up, and they'll be connected to the local area police departments that will have a better opportunity of finding them should they go missing. So we're very grateful for that. We're grateful for the participation of the Fleming Foundation and of our partner, the Bethlehem Health Bureau, who's been extremely helpful in getting this information out and supporting the trainings and just helping us put this valuable resource into the community. So I thank you all for being here, and be sure to let Erica know or Brittany know if you have any questions or need additional information. And with that, I'll turn it back to Erica.
All right, so I'm actually going to turn it over to Brittany and Zori if you guys would like to introduce yourself before we get started with the presentation.
Sure. So hi, everyone. Thanks for joining our virtual session. My name is Brittany Pantoni. I work at the Bethlehem Health Bureau. I've been working here for a little over a year, and I work in public health emergency preparedness. So what I do with Project Lifesaver is basically I'm just helping Zori, get information out, explain to people what the program is. We coordinate the trainings, anything else that she might need for this program. And Zori, do you want to introduce yourself?
Okay, my name is Zori Garcia, and I've been at the Health Bureau for 22 years. And I started with the HIV/AIDS program, and I moved to the chronic department 3 years ago. And they gave me the Project Lifesaver program. And what I do with the Project Lifesaver program, I do their applications. Either I go to their homes or they come to the office, and then we put on the bracelet. And also we monitor that through the whole year. Brittany?
Sorry, we're in the same room, so we can't have our mics on at the same time. Otherwise, it'll do a crazy echo. So yeah, I'll get started with our presentation here. So this is obviously Project Lifesaver. Their tagline is bringing loved ones home. So what is Project Lifesaver? Project Lifesaver is a community-based nonprofit organization. It was founded in 1999 in Chesapeake, Virginia. This program was designed to protect and, when necessary, quickly locate individuals who tend to wander. And since the inception of the organization, the program has grown internationally and has proven an effective method of bringing loved ones home. So who qualifies for this program? So these are the list of cognitive disorders that someone has to have proof of in order to qualify for a Project Lifesaver bracelet. So Alzheimer's disease, dementia, Down syndrome, autism. There's also the other category. We've had people with either multiple of these or ADHD, even some, any cognitive dysfunction that would put them at risk of wandering is someone who qualifies for this program. And in order to qualify, they have to have medical proof. So they have to have doctor's records that says that they have these conditions. How does it work? The important part. So a client wears a transmitter on their wrist or their ankle. So that's what that circular disc is with that cover and the bracelet itself. So that blue bracelet is made out of a nylon fabric. So it's similar to a hospital bracelet. It can't be taken off unless it's cut off by some scissors. And the transmitter itself, the cover is what you see there. Underneath is the actual transmitter and the battery. The covers come in many different colors, and so do the bands. So each transmitter on a bracelet has a unique frequency that is emitted from it. So when a loved one goes missing, you can give 911. You'll call 911 first. You'll give them the frequency number, and they will relay that to the police, and the police will use their equipment to search for that unique frequency number. The average time for locating a missing person with a Project Lifesaver bracelet is 30 minutes, which is pretty impressive. It's actually 93% less time than a standard search and rescue operation without a Project Lifesaver bracelet. So again, that transmitter is unique to that person. So they'll be able to put that into their equipment. It's very, like you can see the receiver that the person's holding in the background. They'll plug it into there and it'll chirp when it's near it. So they'll have directional location of that bracelet, and they'll do a triangular search and kind of zero in on where that person would be, or at least where the bracelet would be. How do you enroll a loved one? So you will contact the Bethlehem Health Bureau to make an appointment, and enrollment, all the equipment, batteries, everything is completely free. So we are the main contact, and then we take your information and we will just we'll distribute that to the police departments and the 911 dispatch center, and then we'll also have a copy of it on hand if anyone needs replacements, if anything. And the caregiver is responsible for checking the bracelet every single day. So there's a battery in there that needs to be checked every day, because if the battery is dead, the bracelet does not work. And we will be sending out text reminders to change the batteries every 2 months. And we also provide batteries if the client ever runs out. Zori, do you want to talk a little bit about the application process and show them what a real bracelet looks like?
Okay, so the application, like I said, they could come to the office or we could go to their homes to do the application. We do it in GIS. Once that application is done, I send a copy of that application to the 911 center and also to the Bethlehem, for the police department that they live. So if they live in Northampton, Northampton will get a copy, or if they live in Bath or in Hellertown, they will get a copy, and so does the 911 center dispatcher. Also, the caregiver has instruction, a piece of paper like this, where it has the frequency number and what to do in case a loved one disappears, and it has all that information, and they will call, and this is will tell them what to do if someone disappears. This is the device that goes inside the bracelet. As you can see, there's a number there. That's the number that the police will be looking for. They will put that in the system, the machines that they have, and they will look for this number. This is the frequency number. That is why it's very important to have the frequency number, that the caregiver knows that frequency number, because without that frequency number, they won't be able to find them. So they must have the frequency number in order to find that person. So all this goes here in, I will show you that. All this goes in the bracelet. That frequency number goes in the bracelet, and then the battery goes with it, and it gets sealed back there, and then it gets put in here in order for them to have it on their wrist. Every day, the caregiver has a daily log for make sure that they check that battery every day. Okay, they will put their initials and the time they check that battery. It is important because the police will ask them, was that battery checked? So that battery has to be checked every day. And even though the battery is working in the 2 months period, you need to change that battery every 2 months because we do provide batteries for the whole year and also bracelets for the whole year. Ready?
Thanks. And like Zori said, the bracelet itself gets sealed, so it's waterproof. And there's a lot of moving parts in this operation. Obviously, we do the application, we provide all the equipment to the police officers and the clients, but the caregiver does have a lot of responsibility of checking that bracelet. Because like I said, if the battery's dead, it won't work. If they go out and wander with a dead battery in their bracelet, the equipment that the police officers have, it won't make a sound. So they won't be able to find that. So it's really important that the caregiver has that responsibility. And also the person wearing the bracelet has a responsibility of keeping that bracelet on. And the caregiver has to make sure that that person keeps the bracelet on as well, because obviously it won't work if they're not wearing the bracelet. So go ahead.
Yes, so as you can see, I put this back on the bracelet, and this is the battery tester. Once I put this on top, you see the blinking? Okay, that means the battery is working. So that battery has to work every day. That battery doesn't work, you need to change that battery. Thanks, Brittany.
So the battery does last 2 months, and like we said, we would give them replacement batteries. So it shouldn't be a problem. We would be on top of it. Even some of the trained police officers go out and do house visits every 2 months or so and make sure that the bracelet's working. They actually go in themselves and test it, just like Zori demonstrated. On this next slide is actually the list of the police departments that we have trained so far in the Northampton County / places of Bethlehem City that leak into Lehigh County. So at us as the Bethlehem Health Bureau, I want to be clear on this because I know that United Way stretches over the whole Lehigh Valley. The Bethlehem Health Bureau only services people that live in these jurisdictions that have trained police departments, and people that live in Northampton County that may live close enough to one of these police departments. But if they live outside of that jurisdiction, we're really hesitant to provide them with a bracelet. I mean, our goal is to have every police department in Northampton County trained in Project Lifesaver and have the equipment to be able to perform a search. So this is the list. And we're looking to expand. And I think this is our last slide. So this is our contact information. Zori is going to be your main source of contact for any referrals, or if you are interested in getting a bracelet for a loved one. That's her direct phone number. You can also call the front desk. I'm more of a behind the scenes person with it. I'm not going to be the one fitting the person for the bracelet, but you can still give me a call if you have any questions, or you can give me an email. So Zori said, with the application, you can come to the Bethlehem Health Bureau, which is right by Main Street in downtown Bethlehem on Church Street. Or if you are too far out, we can go do a house visit and we can fit the bracelet there and do the application there. For more information on Project Lifesaver, if you have any other questions on Project Lifesaver as a program and an organization, projectlifesaver.org, or if you want to scan that QR code, will take you to their hub of all their information, any question you might have about them as a program. And it will also show you locations where Project Lifesaver is nationally and internationally. So if you live in Bethlehem and let's say you go on vacation in Florida, you can look on projectlifesaver.org. You can see where the police departments around you are in Florida. And, we can either reach out to them, the client can reach out to them, and we can kind of coordinate with that police department and say, hey, we have someone with a Project Lifesaver bracelet that's coming on vacation between this and this date. Just to put it on your radar, if they give 911 a call, they have a Project Lifesaver bracelet and you're the nearest department that's trained. So that's a really useful tool for clients as well as us, because we can also kind of locate if someone calls us and says, hey, we're going on vacation, what do I do? We can go on there and see, and we can connect with those departments. So I'm going to stop my sharing and, actually, how do I get back here? I want to put our contact information up in case anyone needs it. And this is a time where I would take any questions. If you guys have any questions about anything, can you go ahead?
I just want to reiterate real quick. I know we had some people come in late. So if you did come in late, this session is being recorded and we will have it posted sometime in the near future. And that link will be shared out to everyone who attended today. But we'll open the floor to questions. If you want to ask your question in the chat, that's fine. If you want to come off of mute, you can do that as well.
Question. The bracelets then have to be put on and removed daily, correct?
No, the bracelet stays on 24/7.
Okay, so it stays on 24/7. So
yeah, only if the band itself is damaged, we provide replacements for the bands. But no, they don't get taken on and off. They can sleep with them. They're waterproof, showerproof, everything like that. So they should be on 24/7.
When they're put on, do they stay on? In other words, you put it on a client and the client, I don't know, is uncomfortable with it or doesn't like it for whatever reason, they can take it off? Or once you put it on, it has some sort of special lock or something that you can't take it off once it's on?
It's like a hospital bracelet. So it has the lock on it. It won't slide off. They will have to cut it off. And it's actually funny because one of the officers that we trained, he put it on just to see, and during the training was like, oh shoot, like it really doesn't come off, and we had to find a scissors to cut it off of him. So yeah.
Hi, it's Angela Clark here. I just had a question. So just to reiterate, there's no income specific guidelines to receive these bracelets, correct?
Correct. No income guidelines, just the conditions that we talked about.
Okay, thank you.
All right, Brittany, it looks like we have a question in the chat. Says, thank you for the presentation. If someone is interested in a bracelet, we should call Zori directly or the Bethlehem Health Bureau front desk.
Zori directly would probably be the best bet. And if she's not here, you can leave a message. She'll be responsive on that.
Follow-up question to that, how will they know if the list expands to cover more areas? Is that something that you have posted on the Bethlehem Health Bureau's website?
That's a good question. If we're hosting a training, usually after the training, we will post on our social media. Like we did this past June, we put out a list of the all the ones that we have trained, so the new ones and the ones that were trained previously. If you go on Project Lifesaver, those organizations will also be listed on there. I don't believe we have every organization listed on our website, so that wouldn't be the resource for it, but our social media would be the best way to be updated on that, I would say. I want to make a comment. I was just thinking about this. I think it was Mira had a question about the bracelets. The bracelets don't have to be worn on the wrist. Some would wear it on the ankle, and some even I don't think we've ever encountered this, but our trainer for Project Lifesaver said that he's even sewn it into clothing or an item that they carry all the time. So that's just an alternative if they can't deal with something on their wrist. Another solution to that would be we have it in different colors. So if they have a favorite color, maybe that would be more appetizing for them to wear on their wrist. Or you can even put stickers, you can put rhinestones on it, you can put whatever you want on that actual bracelet, and it would still work just fine. So there's alternatives and ways around people that don't want to wear the bracelet. We try everything before we take a bracelet away from someone. We want to make sure that they have that bracelet in any way possible.
I have a question. This is Judy. I came on a little bit late. I'm not sure if this was already reviewed, but is this only for residents in Bethlehem, or would it be for expanded for a lot of my population lives in Allentown area?
So we don't work with Allentown. I'm going to put the slide back up again for the areas that we do work with. These are all our police officers or police departments that are trained in the Northampton County area. Allentown and Lehigh County, I believe you would have to contact the police department directly. I'm not 100% certain. Is that correct? Who's trained? Allentown? So yeah, so I believe you would contact the Allentown Police Department, if not the Health Bureau. I'm not 100% certain, but yeah, we don't service people that live in Allentown, and we don't service any part of Lehigh County that's not in actual Bethlehem City.
So just to reiterate on that, it's Angela. It doesn't necessarily mean that this Project Lifesaver isn't being partaked in those areas. It may be there. The Allentown Health Bureau, as well as Lehigh County and Allentown, they may have this in effect as well. It's just
yeah.
Because you're a part of this meeting today, you're not aware that that's taking place there. Correct?
Yes.
Okay.
So
okay.
I believe it's every police department in Lehigh County is trained in Project Lifesaver. Every
Okay.
single one. So that area is completely covered. Northampton County, we're almost there. But we just have those smaller police departments that need to be trained. But yeah, if you are in Lehigh County, not in Bethlehem City, that's where you would go. I believe you would go straight to the police department.
Okay. Thank you very much for clearing that up. Thank you.
Yeah. And that's not
Judy,
to say
I hope
that
that helps.
oh.
Go ahead. I'm sorry.
That's okay. That's
that
not
was
to
helpful.
say that
Thank
the police departments would work together also if they're on a border somewhere and they need help and a nearby police department has the equipment. They can all work together. It's a very collaborative effort. The police departments are very much like we're all in the same team. We're gonna help each other out. If we cross the line of, we're in Hellertown versus Bethlehem, like it's not a big deal to them. They will work together.
These are all great questions. I just want to reach out and see, does anyone else have any other questions? Like I said, feel free to come off mute and ask, or if you want, you can throw it in the chat and I'll ask.
It's Angela again. I love questions because that's how you get answers. Informative. Could you just post the screen up again, Brittany, of what areas you do cover as far as Alzheimer's, Parkinson's, those things for those of us that, yeah, exactly. Thank you so much. And could you specify as far as other, what would go under other?
So we only have one person, I would say, that's classified as other, and it was they were wandering because they were depressed and were threatening to take their own life. So that falls under other. Any other, if they still do have to have a medical record of that. We have some people that have ADD, ADHD, any spectrum of autism, if they have a history of wandering off. Yeah, that's the only instance I can think of as other.
Okay.
But yeah, but any, like I said, any cognitive dysfunction that puts
Okay.
them at risk of wandering. So there's a lot under that, but we haven't experienced any specific examples of it other than that one.
Thank you.
All right, well, if there are no other questions, we'll go ahead and wrap this up. So once again, thank you all for joining today. This session is being recorded, so it will be shared out probably late next week. And I will share out a link to everyone who attended of the webpage where they can view the recording. Feel free to share it with coworkers, friends, family. Anything else you want to say, Brittany?
Nope, that's it. Thank you everyone who has attended. And if you have any other questions, please let me or Zori know.
Thank you all.
Thank you.